All right, everyone. Last but certainly not least, we have OpenFlexure Microscope, presented by Richard Bowman.
Microscopes are key to every healthcare lab, used for diagnosing infections or cancer. But many labs in sub-Saharan Africa lack the microscopes or the expert technicians needed to diagnose life-threatening conditions, contributing to millions of deaths a year. Donated equipment sounds like a solution, but often it can't be repaired or maintained locally. Over half of donations end up unused. Our solution is the OpenFlexure Microscope. It's an automated digital microscope that scans patient samples for record keeping, remote diagnosis, or medical training. It's a lab-grade instrument that can recognize parasites in blood smears or cancerous cells in biopsies, meaning patients can be confidently diagnosed without having to travel hundreds of miles. Our microscope is designed to be made and maintained locally using 3D printing and commodity components, reducing reliance on overseas companies for proprietary consumables or for support. We've trialed it in Tanzania and Rwanda with great feedback from local pathologists and visiting experts who called it an invaluable tool with the potential to help millions of patients. Our pilot microscopes are still in use for monthly tumor conferences between Butere and Houston. The OpenFlexure project started in 2016 with one person in a lab in the UK. It has since grown to hundreds of people in over 50 countries around the world. I'm Richard, with 15 years experience developing laboratory microscopes. Julian is a leader in the open hardware community who formerly worked at NIST. And Joe has installed the OpenFlexure microscope for clinical use in hospitals around the world. The OpenFlexure community has trialed the microscope in Brazil, Rwanda, Tanzania, Cameroon, and the Philippines. And our network includes specialists in breast cancer, cervical cancer, and malaria, as well as local manufacturers like BTEC in Tanzania. These local partners have been on board since the very start, and they're excited to become the first microscope manufacturers in their countries. We have a new business model. Our core IP, the microscope design, is released freely under an open source license. That means control, ownership, and manufacturing jobs stay in the communities where they're needed. And we will support those local manufacturers by maintaining and coordinating the open development of that design. The SOLVE program will help us establish the engineering and administrative team needed to provide that support. And the SOLVE community, we hope, will connect our local manufacturers and their regulators with mentorship and investment that make local production of medical devices a reality. Thank you.